as planners, we affect the built environment every day. We affect matters of health through our choice in building streets with parks, all kinds of infrastructure projects. And we need to build that conversation that planning is not just an academic exercise, that it affects real things and real people. I think the benefits of integrating planning and public health are to bring health professionals and allied organizations into the conversation about planning, to just make sure that we all speak the same language.
Both planners and public health officials bring a specific set of skills to any type of project, and we usually have the same goals and perspectives. We think that more coordination between these two could actually lead to more informed public officials, understanding that the land use and transportation decisions that they make really affect and impact the health of their citizens. Also, a better understanding that while walkable and bikeable communities actually improves public health, it also brings businesses to the area, it creates a sense of place, it brings new residents, and that has an impact on the bottom line for the local community.
I define community engagement as a boots on the ground strategy, where we're just not meeting and advocating for people. We're actually engaging residents and asking them to come to the table to be a part of the strategic planning that involves their actual lives, and be a part of the committee structures and be a part of that dynamic change that will occur when people are actively involved in looking to identify strategies and solutions that impact their quality of life.
Active living has been a priority for Mecklenburg County for quite some time, but we're fortunate to have support from leadership and from our partners in recognizing that how people get to various places is very important, and the built environment really is a factor in somebody's health. And so we certainly have been working on this, but it really having the expertise of the planning community to be on board around the health implications of where somebody lives or how they get to certain places has been fantastic. So there's more voices to be able to advocate to local elected officials or to kind of get community engagement going.
Most times you take government and institutional organizations, they come with an idea and notion that they have the answers that will solve the problems in your community. And that's a narrow perspective, it's a limited perspective that really doesn't embrace what the community sees as its primary needs and ways to go about achieving it. And so rather than coming in and exercising power over organizations, the model needs to be that we share power with. We sit down at the table and we plan together, and we put together strategic and comprehensive plans for implementation that are actually driven primarily by the community.
We chose to use a comprehensive set of strategies because we found that one concept to attack the problem really doesn't work. So our strategies include engaging neighborhood leaders where they are on their terms. We conducted walk audits to identify barriers for walking and biking in the community. We also conducted park access audits to make sure that people could actually get to parks and that once they were there were facilities for all abilities. We've also communicated our outcomes, or will be communicating our outcomes to those agencies that deal with streets and parks and public health, so that they can hear the recommendations and the barriers that came up from the community.
I think it's going to impact the chapter in a very positive way. Since we were successful in helping Centralina Coalition get funded, it's raised awareness of the Plan for Health initiative in North Carolina. There's been a lot of interest. We had 9 applicants that were not selected from North Carolina, so we know there's that interest out there in the state. And what our goal is to bring this forward so that after this funding ends, this becomes an ongoing project of the chapter.
I think it will only continue to improve from here. I think that while we have a momentum going, I think that we'll continue to see more opportunities to partner, but to really have that focus and emphasis on active living and transportation and opportunities for all communities to have access.
The Centralina Health Solution wants to work with our national and state leadership and APA to replicate some of the great work that's been done in the Charlotte region. We would like to hold trainings for planners and public health officials statewide, and do some more walkability audit training, some park access training, so that folks can see how they can implement these goals in their communities.